When dressing, there are several aids which may be of benefit, but not essential. A helping hand, sock aid, or long-handled shoehorn, for example. If your toilet is particularly low, you may like to purchase a raised toilet seat to use for the first week or so, but again, this is not essential. Use the armrests to get in and out of your chair. Follow the advice from your occupational therapist on how to manage in the kitchen and bathroom. For the first 6 to 8 weeks after your operation, you may struggle to get in the bath. If you have a walk-in shower, you can use this once the wound is dry. Take your time and hold on to something solid when getting in and out, or have someone with you. It is advisable to have an anti-slip mat for safety. If your shower is in the bath, once you're comfortable enough to stand on your new hip and get into the bath, you may have a shower. Having a bath is more likely to take 6 to 8 weeks, as standing up from a sitting position will be challenging. If you don't have a walk-in shower or access to one, you will have to stand up and strip wash until you are able to get back into the bath. You may initially require help to wash and dry your feet, or may manage with a combination of a helping hand and a long-handled brush or sponge. Before you come into hospital, arrange your clothes so that you can reach them easily. When dressing, there are several aids which may be of benefit, but not essential. For example, a helping hand, sock aid, or long-handled shoehorn. To get dressed, collect your clothes and your dressing aids if you are using them, and sit somewhere comfortable before you start. If you've purchased the dressing aids, the helping hand can be useful for putting on underwear, trousers and skirts until you can bend far enough to do it for yourself. It is easier to put your operated leg in first when dressing and out last when undressing. The sock aid can be useful for putting on socks until you are flexible enough to do it for yourself. A long-handled shoehorn can be useful initially to put your shoes on and to push your socks, stockings or tights off until you are flexible enough to do it for yourself. If you will be using dressing aids, it is advisable to use them for as short a time as possible, as you want to regain your flexibility as soon as possible. Rearrange the contents of your fridge and cupboards so you can reach the more essential items without bending down. Stocking the freezer with pre-cooked meals which can be reheated will also be useful. A high stool is useful to sit on, for example when you're preparing vegetables or for eating meals. All heavy work, for example vacuuming, making beds and cleaning, should be done by somebody else. In order to drive, you need to be nearly pain-free, not dependent on walking aids, and have a good range of movement. You must have sufficient reflexes to manage an emergency stop. This is usually 6 weeks after your operation. Remember to have a test drive and practice an emergency stop with an experienced driver before driving on your own. It is advisable to contact your insurance company before you start driving, as this may affect your policy. Please check with the surgeon when you can go back to work. If you need a medical certificate for your employer, please ask the nurses before you leave hospital. Further certificates can be obtained from your GP. If you have a desk job, you may be able to return sooner than if you have a very active job. This will only be about 4 to 8 weeks compared to 3 months for a physical job. Returning to a job that involves some light labour is permitted, but for those that involve heavy labour, it is not recommended. We recommend and encourage activities like walking, swimming, static bike, golf and dancing. Sports which involve high impact, such as running and jumping, should be avoided. For example, jogging, tennis, basketball and football. Activities such as roller skating, ice skating, horse riding, road cycling and downhill skiing may be recommenced if you've participated in these activities before, but they are considered high risk and should not be taken up as a new activity after a total hip replacement. Gardening is fine. Long-handled tools may be useful when weeding, etc., but the heavy work, like digging, should be left for 3 months. Start gradually and don't increase the amount of work until you feel confident and have suffered no adverse symptoms. You should usually be the passive partner when you are recovering. If you would like further advice, please ask the occupational therapist. It is not advisable to fly within 6 weeks of having a joint replacement due to the increased risk of deep vein thrombosis. Long-haul flights should be avoided for 3 months.